Hello everyone, welcome back to What's Up Med. So today in this video, we are going to be learning about some important IBQs in OBGy. So let's start. First one we have is the genital TB. Now how will you confirm that it is a genital TB? So you can see caseating granules here, and you will confirm that it is female genital TB by getting to know that this is the ovary. So it shows that it's a female genital TB. Secondly, we have leiomyosarcoma. So leiomyosarcoma of uterus here. You can see this is a specimen of uterus showing cancerous tissues. Now we have this specimen of Krukenberg tumor. This is a specimen of ovary. This tumor is a very rare tumor. This tumor is malignant. It's a very special kind of name, not usual ones we use. Now we have this specimen of cervix. Here you can see small petechiae or lesions, you can say. These small lesions you can see when you treat the cervix with 5% of acetic acid. This cervix is known as strawberry cervix because it appears like strawberry, and this is caused by Trichomonas vaginalis. So they will just give you this image and ask the causative organism. They can just ask the specific name of this. So be prepared for such type of questions. Now let's learn something about the instruments as well. So this one is your favorite, Sims speculum. Everyone knows about it. This is a set of common cannula. They can ask the use of the common cannula. We use it in the endometrial biopsy or medical termination of pregnancy. So basically, you can see the end. It does help in the curettage. Now, this is a retractor. The name of this retractor is Doan's retractor. This one is also special because this is a manual stethoscope used for fetal heart rate monitoring during the gestational period. So this is known as Pinard's fetal stethoscope. Let's move on to the next slide. Now this position, I think everyone knows about it, but then I just put it for you to remember and revise it. So this one is the lithotomy position. This is the position when a gynae doctor just tells the patient to be in to check the internal organs, genital organs of the female. So this one is the lithotomy position. This is a picture of a scan called as hysterosalpingogram. But in this picture, nothing is abnormal. It's a totally normal picture. You can see the uterus here. You can see the right fallopian tube in this side and left fallopian tube in this side. Okay. Now we have this spillage of dye. When you see that you have put the dye through the vagina and the spillage is normal, going all through the fallopian tube and releasing out here, it means the whole tube, pathway is normal. Now, this one is a picture of uterine cavity and fallopian tube ka scan. Again, the same thing is happening. Hysterosalpingogram. We are injecting the ink through the vagina. Here you can see, but then the ink goes normal up till here. Suddenly it gets inflamed here. Okay, the fallopian tube appears inflamed. This is the condition called as hydrosalpinx. So this is right hydrosalpinx, left hydrosalpinx, together making it a bilateral hydrosalpinx. Okay, this is happening because of if there is some blockage in the fallopian tube. This is a very classical picture of biconvex uterus. Again, we have this uniconvex uterus, banana shaped uterus. One side of fallopian tube, ovary are not developed. Okay, so we can see only one side of the organs. So this is a uniconvex uterus. Again, very famous question. This is the condition of PCOS, polycystic ovary syndrome. You can see string of pearl appearance. The cysts are arranged in that manner that it feels like they are in a string, beaded in a string. So we call it a string of pearl appearance. This condition is very much confused with the condition of hydatidiform mole. You can see here the snowstorm appearance. It happens in complete hydatidiform mole in molar pregnancy. And this picture is snowstorm appearance. Can you all just recognize this specimen? This is a specimen of cervix having cancer. So this is a cervical cancer specimen. Direct question, guys. Now here we can see a fetus. The specific point which is to be focused on is neural tube. So this is a nuchal translucency scan. And the important thing you need to remember here is we need to do it in the first trimester only. We cannot do it after that. And the significance of doing this test is we check certain kind of syndromes. For example, in Down syndrome, it is increased from the normal translucency. We all know about pap smear. So we do pap smear using this brush. And this brush is called as cyto brush. We take the samples from the cervix, put it inside the cervix, rotate it in a certain direction 3 to 5 times. And then we take the samples for the examination. Last picture. This one is a picture of, you can see here uterus coming out of the vagina. So this is a case of uterine prolapse. That is it, guys. I hope you guys like the video. So all the very best from my side. And if you like the video, do share and subscribe. Thank you for watching.